So in Northwestern Health Unit, we were notified of a number of cases of death due to drug overdoses. And so in exploring that situation more, we discovered that there was another community that also had this situation, and that there were neighboring jurisdictions that were also noting that there was contaminated drug supply. So what we found out was that there were a number of different drugs being tested that showed other types of drugs. So an example is that a supply of cocaine was tested and was noted to also contain fentanyl. So it's important that when people are seeing that when there's this type of alert, that people become more aware that there's increased risk happening in the community right now. So there are ways that individuals can protect themselves. So that includes, one, getting a Naloxone kit. So Naloxone is helpful. It's not always helpful, but there's no harm in using it. So if someone is becoming unconscious, weak, non-responsive, try using the Naloxone. It may help. And you may have to try it a number of times. So usually individuals can get 2 or 3 kits and they can try and use it multiple times to see if they get a response. Other things that individuals can do is that they can get drug testing kits from Northwestern Health Units, and that can test for a number of different drugs, including fentanyl, xylazine, and benzodiazepines. Then individuals should avoid using drugs alone. And there are also other things you can do. So there's an app where you can connect with someone in advance of using drugs so that if you're not responsive after, they can call 911 for you. So that's the Lifeguard app. There's also a phone number that you can call that's on our website as well. And that is that also allows a person, if they're using alone, that they can have someone call for them. And then we also suggest that if people are trying a new drug supply or just trying drugs in general, that they should start slowly, because small amounts are less likely to have less of a big impact. And of course, we always encourage people to use sterile, clean, new equipment when using drugs to avoid the spread of disease.